Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot, and we're going to be covering maternity. We're going to be going over high-risk pregnancies. This is going to be part one because there's lots to cover, so I'm definitely going to be doing another Kahoot when it comes to high-risk pregnancies. Before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already, and be sure to check out my website, nexusnursinginstitute.com. There you can sign up for our Next Generation NCLEX Review Part 1 and Part 2. In Part 1, I teach you how to think. I teach you how to think critically. I teach you how the test writers think. I teach you about different situations that may be presented and where your mind is supposed to go. I teach you about priority and delegation. I teach you about critical thinking. In part two, we actually go over NCLEX types of questions and those scenarios and the rationales and the most important things that you need to understand. So if you are studying for your boards, I strongly encourage you to sign up for both part one and part two session. If you're currently in a nursing program, I have something for you. If you have to have a really high grade on your next exam, check out my audio lessons. See if I have one that matches whatever you're going to be testing on soon, okay? Also, you can sign up for a private one-on-one tutoring session, or maybe you don't need tutoring. You just need to pick my mind about something or decision that you need to make as far as your career or nursing. Again, all of those resources can be found on my website, nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms, such as TikTok, Instagram, Facebook, right here on YouTube. My handle's the same everywhere, Nexus Nursing. All right, guys, without any further ado, let's get started. High-risk pregnancy, part one. Okay, your patient is diagnosed with gestational hypertension and they're 32 weeks pregnant. Which findings would you expect to observe? Would it be elevated blood pressure greater than 140/90 without proteinuria greater than 300 milligrams in 24 hours, seizure activity, or severe headache and visual disturbances? Very good. Gestational hypertension. So the patient's blood pressure is going to be over 140/90. Okay. Here's the thing. Number one, without proteinuria. That's what led us to know that we're talking about gestational hypertension versus preeclampsia, right? There's no protein in the urine. No protein in the urine. Patient's blood pressure is higher over 140/90, and it's past the what? The 20-week mark. It has to be past the 20-week gestation, higher than 140/90, and no protein in the urine. Proteinuria greater than 300 milligrams in 24 hours. What are we looking at? Preeclampsia, seizure activity. That patient actually has gone into eclampsia, and severe headache and visual disturbances. That's preeclampsia with what? Severe features. Professor D, do I need to know the difference between all of them? Absolutely. If you're taking maternity, I promise you, you're going to be questioned on this. You have to know it. Okay. Your patient's 36 weeks gestation and they're diagnosed with preeclampsia. Which finding would require immediate intervention? Would it be proteinuria of +1? Would it be a blood pressure of 140/90? Would it be deep tendon reflexes of +3 and clonus, or mild edema in the ankles? Very good. Deep tendon reflexes of +3 and clonus. So let's talk about the other options. The other options, guys, these are part of preeclampsia. We don't want to see it, but that's part of the disorder. So we're going to be treating the patient for these. We expect to see it. We're going to treat the patient for it. But deep tendon reflex of +3, so they have hyper reflexes. Okay, this is a problem. This is a problem. What are we worried about? We're worried about this patient going from pre-eclampsia to what? Eclampsia. Okay, because we're seeing what? Muscle nerve irritation. We're very concerned about this. We don't want the patient to go into seizures. I was going to say something else about this. I can't remember. All right. You're caring for a patient with preeclampsia and they suddenly experience a tonic-clonic seizure. What is going to be your priority action? Are you going to administer IV labetalol? Are you going to apply oxygen and maintain airway patency? Are you going to prepare for immediate delivery, or are you going to insert a urinary catheter? Very good. Who cares about anything else if our patient's dead because they weren't breathing? That's going to be our priority action. You're going to make sure that the patient has a patent airway. You're going to make sure, and if something like this happens, 1 second, guys. Apparently, TikTok doesn't like the subject matter. I just had to do an appeal for this live. Guys on the live, can you still see my screen, or did TikTok get rid of you? Okay, good. Um, what was I saying? So when the patient has that tonic-clonic seizure, they've gone from preeclampsia to actual eclampsia. They're having seizure. You're going to make sure you maintain patent airway. Give the patient oxygen. You do not leave that bedside. You scream for help at the top of your lungs, but you stay right there next to the patient. You make sure that the side rails are up. Hopefully, they're already padded. You want to make sure, if it's possible, have that patient on their left side. Why? We want to increase perfusion, decrease the risk of aspiration, right? Bed in lowest position, but you make sure the airway's patent and you stay at the patient's bedside. You never leave them. You never turn your back to that patient. Your patient presents with severe right upper quadrant pain, nausea, vomiting. Lab results show increased liver enzymes and low platelet count. What do you think is happening here? What should you suspect? Would it be gestational diabetes? Would it be placenta previa? Would it be HELP syndrome? Or would it be abruptio placentae? Very good. HELP syndrome. Look at these symptoms: severe right upper quadrant pain, nausea, vomiting. And here is a detail that made us know, okay, we're dealing with HELP syndrome versus something else. The increased liver enzymes and the low platelet count. I want you to think about it. HELP syndrome, HELLP. What does that stand for? H is for the hepatic dysfunction. The liver's in trouble. Okay. Patient has hemolysis. That's what the H stands for. E, elevated liver enzyme. That's your E and L. What's your other L and P? Low platelet count. The HELP syndrome. Okay, that's what we're dealing with. Gestational diabetes, I already explained what that is. Placenta previa, that is where the placenta is connected to that lower portion of the uterus, and it's either partially or completely blocking that cervical os, right? And then abruptio placenta, by the way, that's a medical emergency. We're going to talk about that later, but that is when the placenta completely detaches from the uterus, okay? That is a medical emergency. You guys do have to know the difference between all four. I promise you, if you're in maternity, you will be questioned about it. Your patient with severe preeclampsia is receiving magnesium sulfate. Which of the following is a sign of magnesium toxicity? Is it hyperactive deep tendon reflexes, respiratory rate of 10 breaths per minute, blood pressure of 160 over 110, or urine output of 40 mLs per hour? What do you guys think? Very good, but I wish more of you guys chose the right answer. I'm kind of concerned that 13 of you guys went with hyperactive deep tendon reflexes. So let's talk about magnesium sulfate. You absolutely need to know this medication. This is a drug of choice for preventing and treating seizure activity, eclampsia. That is a drug of choice. You need to know everything about magnesium sulfate, okay? This is what we're going to do. Now, the thing is, if the patient gets too much, it can cause uh, um, what's the word I'm looking? Smooth muscle relaxation. It could cause the respirations to decrease. Okay. Your respiration should be at least 12 per minute, right? 12 to 22. So respirations of 10 breaths per minute, that's a problem. That means that the most likely this patient's getting too much magnesium sulfate. 13 of you guys went with hyperactive deep tendon reflexes, but guess what? If they're getting too much magnesium sulfate, we would see the opposite. We would see hypoactive deep tendon reflexes because remember, it causes smooth muscle what? Relaxation. We're trying to treat or prevent the patient from having seizure activity. So that couldn't be the answer. One person chose blood pressure of 160 over 110. Absolutely not. And let me make this clear. Although magnesium sulfate has a side effect of lowering the blood pressure, we will never give magnesium sulfate to lower the blood pressure. Why? This is such a dangerous drug. The adverse effects are so dangerous and possibly lethal. We would never give this drug to lower the blood pressure when we have so many wonderful drugs on the market right now that will lower the patient's blood pressure without the horrible adverse effects that can happen, right? So we're not giving magnesium sulfate for hypertension. We're giving magnesium sulfate again for the prevention or treatment of seizure activity when that patient goes into eclampsia. And so, by the way, even if the patient had magnesium sulfate, if anything, we would see that blood pressure go down, not up, like 160 over 110. So that can't be right. And then last, urine output of 40 mLs per hour. What's wrong with that? Urine output's supposed to be at least 30 mLs per hour. And plus, the mag sulfate wouldn't have anything to do with that as well, causing it to have 40 mLs per hour. We want that to happen. So what we're going to be concerned about, sign and symptom of magnesium sulfate toxicity is going to be decreased respirations. We're going to be worried about that. A couple other things you need to know. Are you guys good on the live? Okay, good. A couple other things you need to know about magnesium sulfate. This is going to be given IV. It's going to be given as a piggyback. And I'm telling you right now, it's going to be on the pump. You better bet your bottom dollar. Okay. Ordered response. So your patient being treated for severe preeclampsia begins to show symptoms of magnesium toxicity. What are your nursing interventions going to be in order? Prioritize the order. Here are your options. Assess the level of consciousness, administer calcium gluconate as ordered, assess the deep tendon reflex, and stop magnesium sulfate infusion. What are you going to do first, second, third, and fourth? Prioritize your actions. Martina, stop trying to cheat. I see you asking for the answer. Only 14 of you guys got this correct. All right, let's talk about this. The very first thing you're going to do, whenever something is harming your patient, your first action is always going to be to stop whatever is harming your patient. In this case, the patient's having magnesium toxicity. They're getting too much magnesium. That is harming your patient. First of all, let's talk about those signs and symptoms of magnesium toxicity. If you have max sulfate being infused in your patient, you better be watching out for blurred vision, slurred speech, decreased respiration, severe muscle weakness, to the point that the patient's heart can stop. Remember, your heart is a muscle, okay? So you're going to stop that infusion. That is the first thing you're going to do. After you stop that infusion, you're going to assess the level of consciousness. Are they even responding to you? That's going to give you an idea of what's going on with your patient after you assess. And when you're thinking of prioritization, when you're prioritizing, guys, you always have to think what's going to kill my patient the fastest. So after you stop what is killing your patient and you're trying to decide if you have multiple things to assess, think about what is going to kill your patient the fastest. And that's what you're going to assess first. If you're assessing the patient's level of consciousness, what's being assessed? The brain, right? Can you live without your brain? No. That can kill you. So you're going to assess that first before you assess the muscles, which is the deep tendon reflexes. So you're going to assess level of consciousness first, then assess the deep tendon reflexes. And then after that, you're going to go ahead and give calcium gluconate as ordered. Calcium gluconate, that's what? That's the, what's the word I'm looking for, guys, when you want to reverse something? Calcium gluconate is what to magnesium sulfate? It's the antidote. Thank you. I couldn't think. Listen, it's only 10 a.m. in the 10 o'clock in the morning. I only had my 1 cup of coffee. So yes, we're going to give calcium gluconate to try to reverse the effects of the magnesium. Patients getting magnesium, you're going to have calcium gluconate on hand in case you need to give it. Thank you. Antidote. Your patient is 10 weeks gestation with hyperemesis gravidarum. Which finding is going to be most concerning? Would it be moderate ketonuria, a weight loss of 2 pounds in the past week, blood pressure of 120/70, or dry mucous membranes and poor skin turgor? Oh, you guys are for surprise on the live. Wow. Most of you guys went with dry mucous membranes and skin turgor, which leads to dehydration. Absolutely, dehydration absolutely falls under the list of priorities when it comes to physiological integrity. Absolutely. But what do you think the moderate ketonuria is telling you? This patient has hyperemesis gravidarum. They're vomiting all over the place, right? So they're losing fluid and electrolytes. And the fact that we're seeing moderate ketonuria, what does ketones in your urine tell us? It tells us that this patient is vomiting so much, they've become so malnourished, your body is now burning fat for energy. So when you have to choose between the dry mucous membrane and the poor skin turgor, yes, that's concerning. And the moderate ketonuria, between those two, moderate ketonuria is going to be more concerning because that moderate ketonuria, not only does that lead us to dehydration, just like dry mucous membrane and skin turgor did, right? Not only does it do that, it takes it a step further. It lets us know that this patient is now burning their own fat for energy. Do you guys see the difference of why that ketonuria would be more concerning than the dry mucous membranes and the skin turgor? That's right, Zuri. This is how you're supposed to be thinking, guys, when you're down to two answers and you're trying to figure out which one I should go with. That's how the test writers want you to process your thoughts. All right, let's keep. Well, let me talk about because 9 of you guys chose the weight loss of 2 pounds in the past week. That also is concerning. They're vomiting all over the place, but guess what? It doesn't place their life in danger as much as that moderate ketonuria, what that's telling us. Okay. And let's say moderate ketonuria was not here, you still wouldn't have chosen the weight loss of 2 pounds. You should have gone with the dry mucous membranes and skin turgor. True or false? In ectopic pregnancy, the fertilized ovum is implanted outside of the uterine cavity. Is this true or is this false? Very good. It's true. Anywhere outside of the uterus, if that fertilized ovum is implanted, it's an ectopic pregnancy. Usually, the ectopic pregnancies are in the fallopian tube. It's a tubal pregnancy, but anywhere outside is considered an ectopic pregnancy. True or false? Women are less likely to have a successful subsequent pregnancy after they've had an ectopic pregnancy. Is this true or is this false? It's true. Unfortunately, it's true. Women are less likely to have a successful pregnancy after they've had an ectopic pregnancy. Okay. It doesn't mean it's not going to happen. It just means that they're just a lot less likely for it to happen. And a lot of it has to do with scar tissue formation from the original ectopic pregnancy. So usually after someone has an ectopic pregnancy, their subsequent pregnancy usually, very often, I should say usually, very often will also be an ectopic pregnancy because of that scar tissue formation from the first one. True or false? Ectopic pregnancy is the second leading cause of infertility in women. True or false? What do you guys think? True or false? False. Ectopic pregnancy is the number one, and by far, number one leading cause of infertility in women. After a woman's had an ectopic pregnancy, it's hard. It's the number one leading cause of infertility in women. Select all that apply. What are the three most classic symptoms of an ectopic or tubal pregnancy? Abdominal pain, nausea, delayed menses, vomiting, abnormal bleeding, such as spotting or bloating. Choose three of them. What are the three most common? These are the classic symptoms of ectopic pregnancy. And these three symptoms, guys, are the symptoms that allows the healthcare providers to catch what's going on with the patient, to catch that it's an ectopic pregnancy before it ruptures, which is a medical emergency. It ruptures, patients being rushed to the OR. What do you think those three symptoms are? So most of you guys got the abdominal pain, right? True. And here's the thing with abdominal pain. Almost every single, and I'm saying almost because I'm being conservative with it. I really want to say every, but let me just be safe and say almost. Almost every single ectopic pregnancy, the patient's going to have abdominal pain. Okay. That's the first thing that leads us to know that, okay, something's wrong. All right. So, yes, abdominal pain, nausea, no. Although that is a possible symptom of pregnancy, but not ectopic pregnancy. Delayed menses. The patient was supposed to have, their cycle and they didn't. What's going on? Pregnancy. And vomiting. No, vomiting is a possible symptom of pregnancy, but not tubal or ectopic pregnancy, and abnormal bleeding or spotting. So that patient's pregnant, she knows she's pregnant, but there's spotting going on. So she'll seek help. Abdominal pain, delayed menses, and spotting. Those are the three classic symptoms of ectopic pregnancy. All right, one more. True or false? Your patient's diagnosed with hydatiform molar pregnancy, and it's a viable fetus. Is hydatiform mole, that type of pregnancy, molar pregnancy, is the fetus viable, true or false? False. Very good. And here's the thing, guys. This is why I don't even want to say this. I don't do as many maternity Kahoots or teachings as I used to because for the past while, I'm not going to say how long, but for the past while, when I do, I get these crazy emails and I get these crazy comments. Guys, don't fight with me with the facts. Okay, this is science. I did not make this up. Okay, go fight the scientists. Go fight whoever you think created nature. It's annoying, these crazy emails and comments that I get that I have to delete, and I'm so tired of it. And that's why I really stay away from maternity. I know you guys want the teaching, but it gets annoying. It gets under my skin. So if you're annoyed with the science, if you're annoyed with the facts, don't come in my inbox. Don't come email me. Go contact your congressman or the textbooks or whoever you're upset at when it comes to science. All I'm doing is relaying the information. I promise you I did not make this up, okay? Now that I got that out of the way. Hydatiform mole, guys, this is a cluster of pregnancy-related cells, but it's not a true fetus. It's not viable, okay? They're like grape-like clusters, but it's not a fetus, and I'm not going to go more into that because I don't even want to deal with the craziness. But you do need to know that for testing purposes, okay? Go read more about it in your textbook. All right, that is the last of this. This is part one. Oh, sorry, guys. There are definitely going to be part two, maybe even part three, because there are a lot of disorders in high-risk pregnancies that you're going to be tested on and you need to know about. So just keep your eye open for part two, possibly part three. Now let's see how you guys did.